Good evening. I'm Claude Jacob, Director of San Antonio Metro Health, filling in for Mayor Nirenberg this evening. I'm joined by Bexar County Judge Nelson Wolff. Today we're reporting 417 new cases of COVID-19. Our 7-day moving average has also dropped to 554. Sadly, there are 18 new deaths to report this evening. Please keep their loved ones in your thoughts and prayers. There are 659 patients in area hospitals. There were 70 new admissions, 227 in the ICU, and 112 on ventilators. 81% of patients in area hospitals are unvaccinated, and we now show 21 patients are children. Metro Health is continuing efforts to get eligible individuals vaccinated. As of today, 89.4% of the eligible population has received at least one dose. 74.3% of the eligible population are now fully vaccinated, and this is very promising. Now to Judge Wolff.
Yeah, thank you. And well, we are going in the right direction, down some 41 in patients. But again, we've got to remember we're still getting patients coming in, 70 just yesterday alone. And I think, as we've said, that we're about 74.3 vaccinated with both doses. But let me tell you, that may not get us through what could be a winter surge. You need to remember what happened to us last year. Everybody kind of let the guard down. We got into the winter. We got into January and February, hit record numbers in the hospital, up to 1,520 in one day. So let's get the vaccine if you don't have it. Let's get the booster shot if you haven't had it. I think we've done probably, we're opening Friday, Monday, Tuesday, Wednesday out at the Wonderland site, University Hospital, where we were giving vaccinations. We've probably done about 5,000 or so. I think we did 900 yesterday, another 700 today, but only a few hundred of those were the first shot. So there's still a lot of people out there that have not got their vaccination, and if we want to stop a winter surge that some people are worried about, better be sure and go ahead and get it, and let's not get ourselves in trouble again like we did last year.
Thanks, Judge. Yes, we're seeing an alleviation, but we remain vigilant. So just a few reminders for our viewing audience. As a reminder, the flu shot is available at all Metro Health vaccine pop-up clinics. Please get your flu shot while you stop by for your COVID-19 vaccine. Also, as a reminder, Metro Health will offer booster shots of the Pfizer vaccine to individuals ages 65 and older, as well as adults 18 and older, considered to be at high risk of severe illness from COVID-19. And at the Alamo Drome drive-through vaccine clinic, we're running from noon until 8 p.m., Wednesdays through Fridays. No appointment is needed. However, individuals can also visit covid19.sanantonio.gov to make an appointment. Booster shots will also be given at all Metro Health vaccine pop-up clinics. Finally, for those who have not received your second dose of your one dose of Johnson & Johnson COVID-19 vaccine, you are eligible to receive a $100 HEB gift card if you visit a Metro Health vaccine clinic. This incentive will be available until supplies last. In closing, the City of San Antonio operates 15 no-cost COVID-19 testing sites. To find a testing site, a testing location, or a vaccine clinic, please visit covid19.sanantonio.gov. You can also call the COVID-19 hotline by calling 311 and selecting option 8. Please wear a mask and get vaccinated. Do it for you, do it for your family, do it for San Antonio. Get the latest news and information at covid19.sanantonio.gov. We'll now take any questions from our reporters.
Dr. Jacob, tomorrow is October 1st, the start of Breast Cancer Awareness Month. Can you tell us the importance for those undergoing cancer treatments to get vaccinated against COVID-19?
Yes, regarding COVID-19, again, as you've heard from the judge, we're not out of the woods by any stretch of the imagination. October is National Cancer Awareness Month. We do recommend that folks, that residents and patients check with area providers. We still show that the vaccine is safe and effective. So please check with your area providers. And depending on your condition and the consultation from your clinical provider, this may require a 3-dose series. And so we're staying on message. Vaccines are protective, and we do encourage folks, especially during the Cancer Awareness Month, to get vaccinated.
Dr. Jacob, can you tell us about the gift card incentive program? Has that been successful? How many have y'all been giving out so far? Any kind of feedback on that?
Yes, so we rolled out the gift card incentive program as of last Friday. We're pleased, at least so far, by the activity that we're seeing. We've administered over 300 gift cards to date. We do align them and offer them at our pop-up clinics sponsored by Metro Health. So we do have the calendar available, the schedule of our different locations. Again, if you go to covid19.sanantonio.gov, you can see the schedule. So what we would say is that in addition to reminding folks about the importance of getting vaccinated, this is an incentive to encourage folks to complete their vaccination series. So far so good. It's early yet while we've rolled out this program, and we do appreciate anyone out there that can spread the word and encourage their loved ones to get vaccinated.
Dr. Jacob, we received an email from a local woman who said she was unable to get a flu vaccine at 3 of the local city-operated pop-up locations. She said that you are spreading false information about these pop-ups offering flu vaccines. Could you respond?
Yeah, it's flu season for us, right? We're preparing and we are encouraging folks to get their flu shots. We do provide those flu shots at our Metro Health sponsored pop-up clinics. So we can circle back to that resident just to help them at least navigate. We have not heard that complaint in particular, but just know that just like we're encouraging folks to complete their vaccination series, for those who are eligible to get the booster shots, we're also offering flu shots at our designated pop-up clinics. So we do appreciate your patience with us this fall. This is the best way to protect yourself as we're going into the fall and winter season.
Dr. Jacob, can you talk about, have you heard anything yet about Moderna and J&J boosters?
Good question. So we have not heard as of yet confirmations about where the Food and Drug Administration or the CDC, our federal partners, are in the mix. We are expecting some confirmation over the next couple of weeks. So we remain vigilant. We remain optimistic. So right now, we've at least seen confirmation tied to the Pfizer vaccine, and we're expecting to hear in the coming weeks regarding Moderna and J&J.
What about the, for children? The Pfizer, is it 5 to 11?
So for children, it will be for 5 to 11. Again, we do know that there's been a lot of dialogue and at least a review by the subject matter experts. So for now, we're expecting as soon as possible that we'll get confirmation about the availability of those vaccines for those who are not yet eligible, especially the pediatric population between the ages of 5 and 11. So we're staying, I know we're waiting with bated breath for that confirmation, and then we'll publicize it as soon as we receive guidance and confirmation of the availability and eligibility of that pediatric population.
That's all we have tonight. Thank you.